Right, today I want to talk about uterine fibroid because it is very important that our women get to know and understand what uterine fibroid is all about. I have seen a lot of cases where women come to the clinic assuming that they are pregnant when they are actually not pregnant. So for this reason, I want to talk briefly on what uterine fibroid is and what it is not, and how it could be handled, how it can be treated. First of all, I want to say that it is only women that have uterus. Men don't have uterus. Therefore, uterine fibroid is a disease that affects only women. Women of all ages, of all age groups, can have uterine fibroid. Research have revealed that even children the age of 8 have had uterine fibroid. But it is not very common to see uterine fibroid in prepubertal children, but it can happen because there's nothing like it can never happen in medical sciences. Having said this, the uterus is the organ in which a fetus grows into a baby and then delivery is effected. So uterine fibroid, by way of definition, is a benign growth of the uterine muscles, and there are places in which this uterine fibroid could be found. Uterine fibroid could be found in the outer covering of the uterus, and this is the one that is called subserosal. It can also be found in the uterine muscles, otherwise called intramural fibroid. Also, it could be found right inside the uterine cavity where the fetus would be growing. This kind is called submucosal. Now, what are the possible symptoms or presentations of uterine fibroid? Uterine fibroid may show no symptoms, and when there are no symptoms, it is called asymptomatic. But in some patients, there may be symptoms, and some of the presentations of symptomatic uterine fibroid include pain. Another one may be heavy menstrual bleeding, and of course the feeling of a mass per abdomen. Now, uterine fibroid can also undergo changes such as rate degeneration. Some authorities have also postulated that some uterine fibroid can undergo malignant transformation, in which a benign growth of the uterine muscles can become a malignancy that is cancerous, such as leiomyosarcoma. But let's look at how it is, or how this condition can be handled when it is non-malignant. Some of the presentation in symptomatic uterine fibroid, like I've mentioned, is pain. When there is no pain, there should be no cause for alarm. But when there is pain, that means something has to be done about the uterine fibroid. And there's one more type of uterine fibroid which I should mention before I go into the next segment. That is the one that is called uterine polyp. This kind of uterine fibroid has a stalk. It is not like the other one that is situated inside the uterine muscles. This one has a stalk, This is the one that is called a polyp. So this one can be complicated by what is called twisting. The stomach can twist, and the patient will come down with intense pain. So one of the complications I should also add here is the fact that uterine fibroid can cause infertility. Some authorities say no, it cannot cause infertility. Some others say, depending on the grade of the uterine fibroid can cause infertility. But in all of this, uterine fibroid is not number one factor to the cause of female infertility. However, if there is a coexistence of uterine fibroid and a fetus, the uterine fibroid can serve as a parasite to the fetus, may restrict the space in which the fetus is growing, and sometimes even the placenta can be implanted on that uterine fibroid, and this may not be healthy to the growing fetus inside the womb. Moreover, uterine fibroid may be situated in the lower uterine segment, thereby complicating conception, because when the lower segment is occupied by this uterine fibroid, it means another means have to be used in the delivery process. It's not going to be usual delivery, that is spontaneous delivery, but by way of surgical intervention. Now, why is uterine fibroid important, and why should we know about it? Uterine fibroid is important because a lot of times I have seen patients come to the clinic believing that they are pregnant when they actually are not. I've witnessed a case of a couple who came to the hospital for antenatal registration only to discover that the wife that she has celebrated before coming to the hospital was not pregnant. The couple in question had been married for over 15 years, and they were praying, believing God for the fruit of the womb. And so when the husband noticed that the wife's abdomen was growing, was protruding, he was very happy, he was excited. He told friends, family members, and loved ones that God had answered their prayers. And so on that fateful day, they came to the clinic and they secured their card. And so we had to talk to the couples. But during the course of examination, it was discovered that the mass that we palpated per abdomen did not have the texture of a fetus. It was in some way hard as compared to what a fetus would look like. So it was that point that I suspected that it might not be a baby. So we had to do an ultrasound scan. The ultrasound scan revealed that the woman was having multiple uterine fibroids. Wow. It's like all the expectation, the world of the man crumbled at that instant. I tried to talk to him, I tried to encourage him, I tried to let him see the need of undergoing treatment so that they could eventually have a child of their own. But the man was not consolable. His problem was that everybody had rejoiced that he would soon have a baby. He was wondering what he would tell the people who had known that his wife was pregnant. I understood how that man felt that day. I still understand how people feel when after a long time they have realized that what the wife was carrying was not pregnancy but actually something else. So, what is the way forward? There are two ways of managing this condition. One of the ways of managing it is by the use of pharmacological agents. The other one is by surgery. So if you have somebody or you yourself, you are having this medical condition, you should not hesitate to seek medical advice, medical treatment. I have seen a lot of times people refusing objecting medical treatment because they believe that if they undergo treatment, they might not be able to conceive. No, that's not the case. Having a symptomatic uterine fibroid cannot stop somebody from conceiving, cannot stop conception. If somebody you know, or you yourself in particular, you are a woman and you have symptomatic uterine fibroid, go to the hospital, go to a specialist doctor, go to a gynecologist. Let them examine you, let them carry out the investigations, let them know the best approach that they can use to manage your case. Let them decide for you whether your case would need medical management or surgical intervention. There is no two way about it. You don't have to risk it because the people that you are meeting have sufficient knowledge to see you through your condition. So instead of going to buy herbal mixtures, concoctions, cow urine, cow dungs, all sort of things, please go and see your doctor. If you have a mass in your abdomen, if you are having heavy menstruation every month or your mens is always painful, it might be you have uterine fibroid. Though there are other things that might make painful menstruation, but one of the causes of painful menstruation is a uterine fibroid that is inside, that is submucosal uterine fibroid. It can make painful menstruation and heavy menstrual bleeding. So if somebody that you know or is you yourself is seeing these symptoms in your body, don't hesitate to visit teaching hospital, general practitioners, or any qualified medical doctors who will tell you what to do. From there, you will receive help. The people that are saying that they can handle these cases with herbs might not be correct. They will not be giving you the right information, because as far as those things that they are claiming to use in treating uterine fibroid has no scientific backing, no scientific evidence, what they are saying may not be correct. Don't go and be drinking herbal concoction because it can cause more damage than good. It can result in kidney injuries. It can result in so many untoward consequences that you may end up spending more money than what you would have expected. So let me recap what I have said today. There is a medical condition that is called uterine fibroid. It affects only women because it is only women that have uterus. Some women don't have any symptoms when they have uterine fibroid, while some may have pain, maybe painful menstruation, maybe heavy bleeding during menses, maybe a feeling of a mass the abdomen. If this is the case, it is good to see a doctor where investigation would be carried out, and then you or your relative can be treated. Don't go and see people who are quack, who don't have understanding of what they are doing. And of course, if you have been married for a long time, no conception, and then one day you start feeling a mass in your abdomen, don't stay at home and be rejoicing and say, oh, God has answered my prayers, because it might not be pregnancy. It could be uterine fibroid. So why not find yourself in the consulting room of the gynecologist and have this matter sorted out? I believe that this information will be very useful to everybody out there who is listening to me. And as you've listened to me in this video, I want you to share this information. If you have any question to ask, you can drop it in the comment box, and I will try my best to make sure I respond as soon as I can. Remain blessed, and God bless us. Bye.